Hello, everybody. I'm very sorry that I can't join live the meeting today, but I will take this digital opportunity to talk to you about Work Package 3, the VRONI-study. To start with some basics about familial hypercholesterolemia, or FH for short. FH is an inherited disorder characterized by very high LDL cholesterol levels. Mutations in the LDL receptor in the ApoB or PCSK9 genes result in dysfunctional LDL receptors and consequently in an accumulation of LDL cholesterol. If left untreated, this disorder leads to early manifestation of atherosclerosis, including relevant endpoints like myocardial infarction at young age. But with early diagnosis and treatment in childhood, the cardiovascular risk can be reduced to a normal level. And to be very clear, FH is a common disease. 1 in 250 people is affected, and the majority doesn't know about it. This slide shows the percentage of diagnosed FH cases in different countries. In most countries, including Germany, not even 1% of FH cases are detected. FH remains underdiagnosed and undertreated, and we need to change that. Thus, the VRONI-study was created, and our slogan goal at the same time is heart attack at age 35? Thanks, but no. And this is also the take-home message today. In collaboration with pediatricians all over Bavaria, we offer FH screening free of charge to every child aged 5 to 14 years. And VRONI is intended as a test run for population-based screening program for FH. The local acquired children in the context of preventive examinations or other routine visits. And here you can appreciate a schematic overview of VRONI. The locally acquired blood sample together with informed consent and sent this to the VRONI Study Center, the German Heart Center, Munich. The analysis of LDL cholesterol is performed by the central laboratory, and in case of exceeding the threshold of 130 milligrams per deciliter, followed by genetic testing. Children with FH mutations will be treated and monitored by the local pediatrician or pediatric cardiologist. Moreover, affected families are offered a FH-focused training course at specialized training center by the Department of Social Pediatrics at the TU Munich. On the other hand, there are children with elevated LDL cholesterol levels, but without known pathogenic mutations. These children are screened for secondary causes such as obesity and treated accordingly. And all cases with negative screening for secondary causes will be reviewed individually by a board of experts. FH, so what? The diagnosis of FH represents a psychological challenge for children and families. They are treated by specialized pediatricians or pediatric cardiologists. Furthermore, qualified training centers offer FH-focused training to affected families. And in addition, complementary information about the study and FH are available on our homepage, and there is even a short information booklet for kids in order to explain the disease in a childish language and to outline helpful lifestyle changes in the context of FH. And this timeline shows the most important milestones achieved together since the beginning. To establish the VRONI screening program, several factors were considered, including logistics, infrastructure, data security, ethical, political, legal requirements, the cooperation with pediatricians. And it wasn't easy at all to overcome many bureaucratic hurdles, but During this challenging process, a unique motivated team spirit has been developed, and finally, in September 2020, the first samples reached our laboratory. And this map of Bavaria shows the participating pediatricians in dark blue, as well as the pediatric cardiologists in light blue. As you can see, medical colleagues all over Bavaria are supporting the VRONI-study, and we are very grateful for the active participation we see so far. And I'm proud to present you the big VRONI family. The coordinating activities at the central level, I mean the VRONI Study Center, were combined with a large team. And here you can see the complex VRONI network consisting of the DigiMed management, the Institute of Laboratory, the genetic team under Holger Brokisch, the Bavarian Association for Professionals, Pediatricians, print, graphic design, and the cooperation with Care High for cascade screening of family members, the ethic group with the sociological research study, and finally the specialized training center VRONI Plus. By now, 295 pediatricians subscribed to VRONI-study, and 1,150 children were screened for FH, and thereof 112 children had an LDL greater than 130 milligrams per deciliter and were examined genetically. The results are still outstanding, but will follow in the near future. And here you can see the development of the incoming number of samples over time. Thanks to the motivated pediatricians, the trend is still increasing, and that's just great. VRONI will provide evidence for the feasibility of routine population-based screening for FH in children, and the primary goal is to use genetic and clinical diagnostic tools to identify and treat patients with FH. Moreover, an experimental approach to uncover new FH mutations will be performed. And to sum up, this circle shows the effect of the individual aspects on another. The VRONI-study aims to increase the prevention of FH in Bavaria, and with early diagnosis, we initiate treatment and especially lifestyle change for FH families, and this reduces the number of heart attacks at young age, and not to forget the economic aspect of reduced hospitalizations. As part of the study, we get to know new FH mutations, which means a great scientific contribution to FH research. As you can see, the individual aspects only work together, and that is what VRONI aims for. Yes, I would like to thank my VRONI team. Special thanks are due to the DigiMed management, Ms. Sun, Ms. Decker, Mr. Wieler, Mr. von Scheid. Thank you for your attention. And now I will pass you over to my colleague, Holger Brokisch, for the genetic part of VRONI. Thank you.